The following advertisement is paid for by Wake Radiology UNC Rex.
Hi, I'm Angela Hampton. October is Breast Cancer Awareness Month, and today we're focusing on breast density. Joining me is Dr. Bryan Peters, a breast imaging radiologist at Wake Radiology UNC Rex. Dr. Peters, thanks so much for your time today.
Well, thank you for having me.
Let's start by just defining breast density. What is it?
Okay. Well, the term actually describes the composition of the breast, how much of it is the lower density fatty tissue as compared to the higher density fibroglandular tissue. This is an inherited trait, and it can only be determined looking at a mammogram. Breast density is not something we can measure on any kind of lab test or from physical examination.
Okay, so does having dense breast tissue actually increase your risk for breast cancer?
This is the very important question, Angela, and there's two parts to it. First, it does increase the risk of breast cancer. If you look at the women in the highest density category, they have twice the risk of breast cancer as compared to the average woman. But secondly, breast density also makes it harder to find cancers on the mammogram. The dense tissue is white, kind of like a cloud, and the breast cancers also are white, so they can blend together and be very difficult to visualize. So one of my surgical colleagues often says that looking for breast cancer in a dense breast is like looking for a polar bear in a blizzard.
Oh my goodness, very difficult indeed. So that said, what is the best cancer screening tool for people with dense breast tissue?
Well, 3D mammography or digital breast tomosynthesis is the best way to find breast cancer early. We recommend 3D mammograms for every patient, but especially for patients with dense breast tissue. The traditional mammogram takes a full view picture of the whole breast and superimposes it on a flat image. But the 3D mammogram actually subdivides the breast into 1 millimeter thick slices that we can page through like a book and see much greater detail. We can actually see more breast cancers, we find them earlier, and we know from years of experience that earlier detection translates to better outcomes for our patients.
Absolutely. What about artificial intelligence we hear about? How can that help?
Well, there's a lot of exciting research in that area, and Wake Radiology Rex UNC was the first outpatient imaging practice in the Triangle to institute this, and we use it on all of our 3D screening mammograms. It actually shows more cancers, and in combination with a 3D mammogram, we're able to look at certain findings and say, oh, this is not anything to worry about because the 3D and the AI clarify that. It works in the background while we're reading the mammogram, and we flip it on after we've done a complete, thorough investigation of the mammogram pictures to see if the AI detects any additional findings that we need to investigate. It works in the background like a second check.
Okay, that is exciting, definitely. So how easy is it for a patient to get a 3D mammogram at Wake Radiology?
Well, it's very simple. We have 12 outpatient facilities spread across the Triangle. There should be one that's very convenient to most patients. We try to get you in and out in 30 minutes, and I think you'll find our staff is highly dedicated to, the highest quality of care for their patients.
Okay, very easy indeed, and we hope that people will seek out that information. Dr. Bryan Peters, thank you so much. This was excellent information to pass along to our viewers. Thank you so much.
Thank you for having me.
All right, if you would like to learn more about 3D mammography and all of the exciting things that are offered through Wake Radiology UNC Rex, all you have to do is go to this website, wakerad.com. Again, wakerad.com. Thanks so much for watching our ABC 11 local spotlight on breast density. I'm Angela Hampton. Have a great day.
The previous advertisement was paid for by Wake Radiology UNC Rex.